Welcome to Interdisciplinary Case Miles, a podcast where real runner stories meet clinical expertise. We discuss real cases that are anything from weekend warriors all the way to elite athletes, while using our evidence-informed approach.
I'm Dr. Sara Raiser, a running medicine physician focusing on helping runners prevent and recover from running-related injuries while optimizing health and performance.
I'm Kelsey Pontius, a sports dietitian helping runners to fuel smarter, recover better, and help avoid the risk of injury so that they can meet their goals.
And I'm Dr. Mihevc Edwards. I'm a physical therapist and orthopedic specialist, and I've been treating for runners for over 15 years. And what I do is help them get back stronger and better. Today, we are going to talk about bunions, and we're going to talk about bunions in a little bit differently than we typically do. Usually, we'll give you a very specific case, male, 49 years old, came in presenting with bunions. But today, we want to really think about several cases that we've seen between all of us and kind of put them together so that you can get more information about this. So I'm actually going to let Sara start today, and she's going to start by answering some of the common questions like the idea of what is a bunion, and then how it might present in her clinic first. So go ahead, Sara.
Awesome. Hi, Kate. Hi, Kelsey. Good to see you guys. It's been a little while.
Yeah, it has.
All right. So whenever we talk about bunions, number one, we'll talk about a couple definitions. So a bunion is actually just referring to the bump that you see on the medial or inner aspect of that first big toe joint. So I call it the hallux metatarsophalangeal joint, or basically where you're going to push off through that first big toe. So the bunion itself is actually more kind of the prominence of that bone as you start getting the big toe turning outward. Or you can actually develop a little bit of hypertrophy and changes in that bone when that happens. So generally, when we talk about bunions, we talk about that prominence. We may talk about pain associated with it or the difficulty of fitting shoes with it, swelling that can happen. Sometimes it gets red because it's pushing against the shoe, or related to how we push off through the foot because it's harder to stabilize through that first toe. But Hallux valgus is actually the term I prefer to use, because generally what I'm more concerned about is kind of the mechanical issue as that big toe is turning out. And now we have this big angulation, and it's a lot harder to have what we call first ray stability. So being able to push that big toe into the ground and stabilize through that arch. And that is going to echo all the way up the kinetic chain. As you've heard us talk about before, everything is connected. So, oftentimes when I see folks in clinic, it's not even because they're coming in for pain in the foot. It's because I take off their shoe and we're taking a look at their whole kinetic chain, and I look down and I say, oh, you've got a bunion. And sometimes they'll say, oh, yeah, it never bothers me, or I'm having a lot of pain from it, actually. Or as we're going through functional evaluation, they have a hard time pushing through that big toe. And so oftentimes that can really be the culprit of problems that folks come in with, that they're having pain or dysfunction related to their running programming. And this is limiting them. So, I'll pass it back over to Kate, maybe, if you want to chime in terms of mechanics associated with hallux valgus or bunions.
Absolutely. So people come into my clinic often for two reasons when it comes to bunions. One, they're having pain with their bunion and they're not really sure what to do about it. Or two, they've just started to notice that their feet are looking uglier than they really want. So they will actually say, my feet look horrible. What can I do about this? And I always find that kind of funny, because it's something that happens over time when it comes to bunions. Is you'll start to notice that your toes start to look a little windswept. The more that you're running and the more force you're putting through that big toe or that medial aspect of your foot. And so what happens is when someone has a lack of pronation control, so either they're pronating too quickly, so the speed of their pronation is they're going to hit the ground and then quickly pronate and then push off that actual joint, or they're just staying in that pronated position for a really long time. And so it happens, instead of really pushing off the big toe itself, you're pushing off that medial aspect or that inner aspect of the toe, creating that kind of windswept look in your toes. And so what we do in PT are we actually really work on what you said, Sara, like foot and ankle stability is where we'll start learning how to push off of that great toe. and really changing how we're doing the push off. We'll also think about like strength in the calf muscles all the way up the legs and into the hip, because again, if you're not controlling your hip, you're more likely to end up in a pronated position. So we're really working on kind of derotating and making sure that we're able to look at that limb from the entire aspect, foot all the way up into the hip. The other thing I often look at when we're looking at gait and running form is I'll look at your arm swing. And that sounds kind of funny because looking at your arm swing for a bunion, well, what happens is if you're crossing your arm across your body when you're running, what you're doing is relative rotation on the other side or on the other limb. So if you're, I have a right-left problem. So if your right arm is coming across your body, your left leg is going to rotate in a little bit more. And ultimately, you might end up in more pronation and pushing off from that joint in the big toe. So those are kind of some of the things that I'll start to look at and help people with. Of course, there's other options, which I'll jump into in a little bit about shoes or orthotics or other aspects. But let's pass it off to Kelsey and see what she has to say about this.
My mind is blown right now because I have a bunion on my right side and I'm like connecting all the pieces. And I definitely swing my right arm more when I run. But as a soccer player, I was like right side dominant. And so, which meant the ball was always on my right side. And I swing my right arm, I think, because it was always up when I was playing soccer. Crazy.
Well, that might not be the only reason, of course, but it's part of it. Yeah.
My right arm is always doing something different. It's always been that way, even when I was a soccer player. That's fascinating. Okay, so in theory, I'm hearing you say that essentially like foot movement is a part of how a bunion might form. And so I'm thinking, essentially, if your tendon and ligament health and all of that is affected, then down the road, that's going to affect foot stability.
Mm-hmm. Yes.
Okay. So, I think that there's a lot of like nutrition things at play. In the beginning, before we hit record, I said, I don't know exact connection between nutrition and bunions, but as Kate and Dr. Reiser talks, I'm sure I'll figure it out. And so I think that could go back to just making sure that we're supporting our tendons and ligaments to, really harness that correct foot stability. So making sure that your nutrition supports, your foot mechanics in a way of eating enough, supporting the tendons and ligaments. You have a diet that has a lot of variety in it, not just the macronutrients, but the micronutrients too. I think a lot of times athletes are really quick to think about either just the macronutrients or just think about, what foods are good versus bad. But it takes a multitude of foods to support all of these processes in the body and support tendons and ligaments. And a lot of times people think that if there's musculoskeletal breakdown, they just think bones when they think of nutrition, but tendons and ligaments, as we've talked about in so many episodes, are a part of that breakdown too. Hydration, just to make sure that nutrients are getting to lower extremities. And then I think too, from like a pain perspective, this might not reduce the risk of bunions forming, but once you have one, I definitely think of like anti-inflammatory type of food. So omega-3s is a big one, bright pigmented fruits and vegetables. It's berry season, so that's an easy one. I'm growing some berries right now. I'm very excited about. They take longer than I expected though. So I'm ready for them to be, I can eat them. And then there's a lot of herbs and spices too that help, that have anti-inflammatory benefits. And so things like turmeric, essentially tasteless. That's one of my favorite things. Again, with it being summer, so easy to add into smoothies and essentially is tasteless, easy to get a good amount. Garlic, onion, boswellia, that's a little bit of a different one. Just ask your physician if boswellia is safe. Ultimately, there can be contraindications with any kind of autoimmunity, liver and kidney issues, but extremely power anti-inflammatory agent.
Awesome. And I think all of that's so good. I think anytime we are dealing with conditions where you can have fatigue that leads to breakdown of your mechanics. I think it's huge to be addressing the nutritional component. If you have low energy availability, those mechanics are going to break down a lot sooner than you might like. Two thoughts that I had. So number one, whenever I'm looking at bunions and like actually specifically looking at the foot, One thing that I look at is how big is the angle of that hallux valgus, so that toe turning out, and is it reducible? Well, oh, three. And can they actually activate their muscles? So can they abduct that big toe? Can they do their toe yoga exercise where they isolate the big toe versus the small toes? So how much neuromuscular control do they already have, and can we potentially obtain by going to physical therapy and really addressing these pieces of it? So that's kind of a quick screen that I will do to figure out how much of this can we bring back. Certainly if you have a rigid big toe and you cannot reduce it back to that biomechanically advantageous position, so that straight big toe, we're going to deal with a little bit more of trying to find ways to kind of a bubble wrap, if you will, that big toe to stabilize it the best that we can, recognizing that we can't put it back in the position that we need to. And then comes the question of surgery, which is a question I get very frequently. Do I need to have surgery on my bunion? And if you talk to different podiatrists, foot and ankle docs, surgeons, they will give you potentially different answers. I will say the number one answer that I get is if it doesn't hurt, oftentimes surgeons are going to recommend not actually doing a surgery. I do think there's a consideration for what type of sport you want to do, and does the alignment really matter, and can we get you back into good alignment and have good stability through that lower quarter? Because certainly if there's a lot of destabilization, I worry so much about the health of all the joints and your function and quality of life. But I also think it's hard to justify going to a surgery if that bunion and big toe doesn't actually cause pain or major dysfunction. So that is a very individualized conversation that I'll have with folks, but very frequently that I'll get folks in the office that ask about it. And a bunion surgery, a bunion correction surgery, there are so many of them. So if you are going to do it, research it, talk to different docs, ask what they do, what their rate of success is. If it doesn't go well, what generally happens. So asking all of those questions, if you are going to search around and consider doing a surgery, make sure you do your homework and really feel comfortable with moving forward with it. Generally, when I'm seeing folks, they've either had a surgery a long time ago, or we're really trying to do our best to work through physical therapy, potentially work with bracing, put a silicone insert between that first and second toe. What can we do to kind of really improve those mechanics, and then potentially taking some stack height and cushion out of your shoes so you can actually get some proprioceptive feedback. So I do it as much as I possibly can to try to take the surgical piece out, but occasionally it is the right thing to do depending on what's going on.
Yeah, that's great, Sarah. And some of the things that you said are obviously things that I'll be talking to my patients about as well, because you and I overlap quite a bit. I almost always ask them to get the toe spreaders, and I'll usually have them do not just between the first and second toes, but through all five, just to help with the neuromuscular control of the feet in general. Because even if they can't really get that first ray or those muscles around the first ray working quite as well as I'd like, if we can get more activity from the other muscles, that would be still great. So that's something I have people do. They can put them in their shoes while they're running, or if it's really annoying, because it can be, they can just walk around the house with them in their slippers or in other shoes. And so that's definitely something I'll do in the beginning. And that whole piece about the toe yoga, it is shocking how hard it is to lift your big toe if you haven't been working on that. And so I practice a lot myself, because I always have to demonstrate it to patients. And if you can't do it, you can't make your patient do it. And so having them go through and show me, can they lift their big toe? Can they lift their second toe, third toe, fourth toe? Can they spread those toes out? And if they can, like you said, we'll work through that. If they can a little bit, we'll still work through it. But if that toe is really rigid, we may also consider some joint mobilization if they can tolerate it. A lot of times we'll have to work on joint mobilization through the ankle, so the talocrural joint and the subtalar joint as well, to help with that pronation supination control, which means I'll also be looking at the tib-fib joint, which is kind of that outside bump of your foot and ankle all the way up to your knee, just to try and get as much motion in all the other places as possible. Because if we have lack of motion at the great toe or the first ray, then we really need to help it in all the other areas. The other thing is you mentioned too, taking some of that stack height down, maybe some of the cushion out of their shoes. So definitely looking at that, but also looking at the size of the toe box for the shoes. Sometimes we'll have to change the size of the toe box to make it more comfortable, either to accommodate those silicone toe spreaders, or just because their foot has changed so much due to everything that's happened that we might need a wider toe box. And I also might change the way that we tie the shoes, because sometimes if you tie the shoes a certain way with a particular eyelet on the top, you can actually make that medial aspect of the shoe a little bit more stable. And so we'll work through that, as well as, pronation control, posterior tib strength, all of that. And then the surgery piece, which I will say too, is I've seen several people that have had surgery, and I do love what you said about asking a lot of questions, because there are so many different versions of that surgery. Some go really well, some don't go well at all. And I've had people that have not been in pain but wanted to fix the bunion because of the way their foot looked, and then they were in pain and they were no longer able to do what they wanted to do. So those are really great questions that you had said. I hope that everybody asks. Kelsey, do you have
a favorite brand of toe spacer, Kate? Asking for a friend, obviously.
I know that I have it saved, but I can never remember things like that. But wouldn't it be great if a toe spreader company wanted to sponsor us? Hint, hint, is anybody listening? Because then I'll really remember one. No, I'm just kidding. I'll have to look and see what's in my saved files, and I'll send it to you, and then I can attach it in the show notes.
Yeah. And Kelsey, I have a question for you. It actually pertains to one of those little books sitting there on Kate's shelf that I've been reading recently, but talking about sleep to prevent fatigue and good mechanics, right? So I wanted to get your thoughts on kind of the new trends around tart cherry juice and L-theanine and the magnesium threonate specifically. Do you have any opinions on some of those trends right now from the insomniac standpoint?
Yeah, I think that all of those I can support. Different forms of magnesium do different things. So sometimes with my clients, it just takes a little bit of trial and error. Some of them respond a little bit better to the magnesium threonate versus some people respond better to magnesium biglycinate. Arguably, both can have sleep benefits. And then tart cherry juice is actually, and tart cherry, like just the compound in general, is just very well studied. What makes it good for sleep? Actually, it'd be a great thing for bunions in general, because it's anti-inflammatory, and then it does have natural melatonin in it. And so, as a part of a bedtime snack or before you go to bed, 30 minutes before sleep, that would also be great. And then L-theanine is so interesting. In theory, the mechanism behind it is that it can just calm your central nervous system, similar to magnesium. But in some people, I'm this way, is that sometimes when some of us calm down a lot, we're able to focus a little bit more. And so it just takes a little bit of trial and error. So if you're hearing this and you've been struggling with sleep, then maybe just try one of these things at a time, and then try each of these things for maybe a week in isolation. Unless, of course, you try the magnesium and it works great, and then problem solve. But yeah, I think that all of those are well studied. I recommend all of those depending on the case to my clients. And yeah, I think that mechanical breakdown, every episode we do, I think I appreciate it more and more about how nutrition and how sleep, you don't know what the end result of injury might be or how it might manifest in our body, but it's such a big component, even in an acute sense, like, oh, I had a bad week of sleep, or I got a little bit behind on my fueling because life happened. So that's where I'm kind of a big fan of being really flexible in training. That doesn't mean that you can't go out for your training at all, but do we need to modify when those two things aren't up to speed? And the older that I get as an athlete, the more I try to do it before you have to take a forced break.
That's something I talk about with my patients almost every single week, Kelsey, is it's okay if you have to change like a training, your training plan. It's okay if you have to make a modification on your training schedule, especially if you're not sleeping well, because sleep, like you said, it's a performance enhancer, but it's also something, if it's not going well, can put you in a space where it's easier for you to break down. And there's so much research out there about it. And it's something that we absolutely have to think about as athletes athletes, whether we're young athletes or we're aging athletes. We have to think about how does that impact our ability to go out there and perform. And if you're exhausted on a run, biomechanically, you're going to break down. Your muscles aren't going to fire the same way that they would. All of your systems aren't going to be functioning at the highest level.
Yeah, there's a big argument that women in their like 32 to late 30s are the best at marathoning. And some people think it's due to their hormone composition, but I really do think as like an athlete that's in that stage of my life, as you start making better decisions, you kind of have to, but you start making smarter decisions and working smarter and not harder. And I think that that ages really, really well in like a distance, like a marathon or half marathon and so forth.
I totally agree. And I actually think not only are you making smarter choices, you're more confident in your body. You know how your body responds to training. And you don't care as much about what other people are thinking because you really are trying to hone in on what you know about yourself and you've learned a lot. So I think it's true.
Totally. I actually, a couple months ago, I learned this the hard way. I had a reminder the hard way of where I tried to push through a workout. And I felt like poo and got through it. And I was sore the next day. And I was like, I knew it. I should have done that. So I've been making better decisions ever since that. But I feel like every now and then we have to have that reminder too that when your body's talking, you should listen.
That's right. Well, I think that that's a great wrap up for this episode. Unless maybe we could each call out one thing that we want people to really take away from this idea of bunions, even though it wasn't a really specific case. I think we covered a lot of really good information. Sara, would you like to start?
Yeah, I think the biggest thing is if you have a bunion or hallux valgus, that you need to pay attention to it, even if it's not causing you pain, because I so often see folks come in with musculoskeletal problems elsewhere, and then it turns out that they have this going on in their feet as well, and we need to address it. So even if it doesn't hurt, we want to address it sooner than later.
Great. Kelsey?
I think it's that we can't predict how like things like underfueling or just not adopting variety into your diet's going to show up, but just knowing that it's important for so many different mechanisms and always asking the question when you're dealing with something that you're not sure how you got there of like, how am I fueling? Am I taking care of my body? Am I making these smart decisions and so forth?
And mine is strength. I think I talk about it I know I talk about it every single episode, and it's maybe you're bored of me saying this by now, but strength is so very important and it starts from the foot and goes all the way up. So when we have strong hips, it impacts our ability to land better and what happens at the foot and vice versa. So if you start to notice that your toes are looking a little funny and you're over pronating, again, pronation is not bad, but if you notice that those things are happening and your toes are becoming more windswept, think about how can I make my foot stronger? How can I make my hip stronger so this doesn't progress? Awesome. Well, thanks a lot, ladies. And thank you so much for listening, everybody. As always, we so very much appreciate you being here. And if you could pass this on to coaches, running partners, other friends, anybody you know that might be interested in something like this, we would love that, because our whole point of doing this is just helping to educate people to keep them in a better place, either coming back from injury or hopefully decreasing the possibility of them getting an injury. So please subscribe, follow, and we will see you next time. Thanks.